Informed consent prior to immunization, consent for series process. Adult immunization. Client has the capacity to consent for self. May 2013. Health clinic visits involve complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent. The purpose of the following demonstration is to show how you as a vaccine provider can use your skills to assess adults who present for immunizations with unique cognitive and communication abilities. The process for obtaining informed consent consists of 7 steps and is outlined in the BCCDC Immunization Program Manual, Chapter 2. During an immunization appointment, these steps will be completed as part of your overall appointment and may not be done in order. For the purpose of this demonstration, the following order is being used. Step 1. Determining authority. Every adult has the authority to give, refuse, or revoke consent for his or herself for immunization. If the adult demonstrates that he or she is not capable of making the informed decision to be immunized, the adult does not have the authority to give consent.
Good afternoon. My name's Jessica. I'm a registered nurse, and I'll be doing your immunization today.
Hi, I'm Anne, and this is Ginger. She's come for a flu shot.
Okay, great. Nice to meet you. I see that you're nodding at me, Ginger.
Yeah, Ginger nods her head for yes and shakes her head for no.
Oh, okay. That's really good for me to know. Thanks for saying that. So, Ginger, I just want to tell you a little bit about what influenza or the flu is.
Step 2. Assess capability. The vaccine provider approaches Ginger with the presumption that she is capable of making her own decisions. Ginger is demonstrating a level of understanding because she is presented for her flu shot and she is actively engaged in the conversation. Even though Ginger does not exchange words, her interactions demonstrate how she communicates. The vaccine provider's responsibility is to continue assessing Ginger throughout the appointment, taking into consideration Ginger's cognitive function, her communication, language, and input from the caregiver. Given time and given the necessary information and support, most adults can make their own decisions. This principle is very important because it forms the basis for providing client-centered care, where the vaccine provider may have challenges in assessing and communicating with an adult. Step 3. Provide standard information. The vaccine provider will provide the client with standard information and key points from the vaccine health file about the benefits and risks of receiving the vaccine, the common and expected side effects, the possibility of serious or more severe adverse events and how often they occur, and any contraindication to receiving the vaccine.
Ginger, I just want to tell you a little bit about what influenza or the flu is. Okay, so I'm going to use this HealthLink BC file and it's just going to give us some information. So basically the flu is a virus and what it does is it gives you cough and a fever together. Then what can happen is from 5 days to a week you can have that cough and a fever. You can also feel like really weak and tired in your muscles and have aches. Does that make sense? Yeah. And something that can happen, a complication of flu, is pneumonia, which means it's an infection in your lungs, and sometimes you'd have to go to the hospital and go on IV antibiotics. So that's definitely something we want to prevent. So that's the whole purpose of giving you the flu shot, is instead of getting sick with those symptoms, we can protect you from that illness. Okay, great. So I just need to ask you, Ginger, some questions about your health. So are you feeling well today?
Yeah, Ginger has been very well this year.
Okay, good, great. Did you have a flu shot last year, Ginger? Okay. And did you get a sore arm at all after the injection? No? Okay. Any problems with shots or immunizations in the past? So I hear that you're feeling well today, you've had a shot last year, you've never had any problems with shots. I just want to ask you a few more questions. Do you have any allergies? All right. Do you both know that you need to wait 15 minutes today after the immunization?
Well, we had forgotten about that. Thanks for mentioning it.
Okay, great. Why we want you to wait for 15 minutes is because After having a flu shot, it's very rare, it's fewer than 1 out of a million. Sometimes you can develop an allergic reaction, but it's life-threatening, so it's called anaphylaxis. But what it is where someone can get kind of bumps or hives on their body, swelling of their throat or their tongue and lips, and have problems breathing. So that's an emergency. So right away, I would give this adrenaline treatment to stop it, and we would call 911, okay? And when you get home, if that were to happen, I would want you to call 911 right away.
Okay, we'll do that.
You'll do that. That makes sense? So I just want to go into a couple of side effects that you could have after the influenza vaccine. Side effects can be redness or swelling or a puffy arm here. You could also have a headache or feel sore in your muscles. Does that make sense? Yeah? If you had side effects like that, Ginger, it's really important for you to tell someone, like Anne or your other caregivers. Some people, if they have a headache, their muscles are sore, if they get a fever, they want to take acetaminophen. Oh, are you able to take that? Yeah? So a couple more side effects I want to talk about is that some people feel tired for 1 or 2 days after the flu shot, and that's normal. I know I've listed off a lot of potential common reactions to the influenza vaccine, but they're generally mild. You may not have any of them, but it's still so much better than being at risk for actual influenza disease or those complications like pneumonia.
Okay. She's never had that.
She's never had that.
No,
okay.
I've been with her for 5 years, so.
That history is really helpful for me to know. Thanks for that information, Anne. So there's just 2 other things I want to talk to you about. These are less common, but they can happen. One happens maybe in 1 out of 20 people. It's called ocular respiratory syndrome. Well, what does that mean? It basically means that you get a sore throat, a hoarse voice with maybe a cough, and redness in both of your eyes. The last one is very rare. It's about 1 in a million. It happens in most people after an infection. It's called Guillain-Barré syndrome. What it means is that you get weakness in your body muscles or you're not able to move them. So if that happened, Ginger, I would want you to tell Anne or one of your caregivers right away.
Step 4. Confirm understanding. Understanding is confirmed as Ginger communicates her answers to the questions by nodding yes or shaking her head no. Her actions and demeanor show she is engaged in the conversation. Step 5. Provide opportunity for questions.
I've gone through all this information. Do either of you have questions for me about it?
We were planning on going shopping afterwards. Is that okay?
That's fine. You can do all your normal activities just after waiting that 15 minutes.
Yeah, that's great.
And if you guys have any questions after, you can always call back to us at the health unit.
Super.
Step 6. Confirm consent.
So do I have your permission today then, Ginger, to give you the flu shot?
Step 7. Document consent or refusal. The vaccine provider documents that informed consent has been assessed and obtained according to health authority guidelines or practice area. The vaccine provider provides a record to the client as proof of immunization.